Hi, it's Dustin Lanier. Thanks for listening. Please find me on LinkedIn for original public sector operations content every week. And please reach out to me if I and my team of procurement professionals at Civic Initiatives can help you be a public procurement change agent. We're going to talk today about supply chain and public procurement with our practitioner panel. We are recording the first portion of the event for a podcast called Public Procurement Change Agent, which allows people who are not yet on Clubhouse but are interested in public procurement to be able to hear and participate in our conversation. I have a panel of practitioners on the stage. Today, I wanted to talk about supply chain and public procurement. We have an interview with Rob Handfield tomorrow on LinkedIn Live, who is a supply chain luminary and helped do a report for NASPO recently on the effect of COVID. So this was a good way to lead into that conversation. I did a poll a couple of days ago asking what was the most important 2021 supply chain characteristic, giving some choices between vaccine supply and distribution, domestic creation of PPE, and replenishing our federal stockpiles. So I think they're all important. The vaccine distribution and acquisition and distribution was the top by far. Maybe ask Jamie, I don't know, is the state of Maine involved directly in the vaccine acquisition, or what role does the state government have in the acquisition and distribution of the vaccine today?
So we're not as much involved in the acquisition portion of it because that's really coming from the feds. We ask the feds, can we have this much vaccine? And they either tell us yes or no. What we are doing in our state is trying to be really creative in looking at a very large geographic region and figuring out how do we get the vaccine to people versus having the people come to the vaccine. So just in being very candid, right? The state of Maine is massive. And up in northern Maine, we probably have more moose than we do people. And that is a challenge when you're trying to roll out vaccines. So we just partnered with MEMA, our Maine Emergency Management Association, and we are now doing rolling vaccines, much like you would see a food truck with hot dogs or tacos. We're now rolling out something similar for vaccines that will actually use the Johnson & Johnson vaccine, the one shot, and go to these more rural areas. In addition to that, we have contracted with a company to do like a centralized scheduling software that is in partnership with our Maine CDC, but will also allow our private healthcare entities and some of our pharmacies throughout the state to utilize this software system, which has been a huge help because before this, up until just a week or two ago, we had citizens who are not the most technology savvy, right? 80 and above, 70 and above, they're trying to figure out, how do we call? We don't go online. We don't have internet. We're trying to use our landlines. We can't get through. We're on the phone for hours. So I think the state of Maine has done a really nice job in trying to advance getting the vaccine to people and be creative about some of the challenges that are in front of us. But to answer your question, Dustin, we are not directly acquiring.
How about the rest of you that are still in the public side? Jenny, Christin, Victor, any of you guys have a story about your role in the vaccine acquisition and distribution? Christin, you came off mic, so go ahead and
yeah, I'll jump right in.
Yeah.
Just following. I'm sorry, Christin Webb, purchasing administrator here in Shelby County or Memphis, Tennessee, if you're more familiar with that. But very similar to Jamie, when we talk about a county or city, I'm even further down the totem pole as far as direct acquisition of the vaccine. We are obviously just being more of a distro channel. But what I did appreciate about Jamie's initiative that I heard from her in Maine, what we are doing or just recently started, I've worked with the Agent Commission to contract with a agency that actually goes out into our elderly population to get those vaccines to them. So I wrote down the word innovative when Jamie mentioned that because it is a savvy or creative way to get to those populations that may not have easier access to the vaccines as they become available. So for us here in the purchasing department, we aren't as directly involved other than assisting in the distribution with the departments as they come up with their strategies. So that's my 2 cents on it. But definitely it's high priority for the entire county when we talk about supply chain and those different focuses that you mentioned earlier.
Ahead,
and this
Jenny.
is Jenny. Massachusetts is the same. I think we're getting a limited amount of supply of the vaccine from the federal government, and then it's dispersed out through a process that's been set up. There's a vaccine signup.mass.gov, so you can schedule, and it determines whether you're eligible based on the type of work that you're doing or your age. And then there's also a vaxfinder.mass.gov where you can go and see all the locations that have open appointments and the type of vaccine that they're offering. So those are helping folks at least sign up for it. So it's all done through the websites, and they also have telephone numbers. So if you don't have the internet, they can help you sign up through that process. So pretty consistent with what other states are doing.
Victor, how about you guys? And then we'll move to a different topic. Are you involved in it, or what is your observations on it as you're watching it?
No interaction on my part or procurement's part. It's a whole different department that's handling those.
Okay, so
I'm
please.
just waiting in line until I'm the group that gets to get my shots. So I'm waiting as a private citizen at this time.
Well, I'm pleased to say I got my first one, so I think the ball is rolling. So we did a lot of discussions around when we did some of the new normal exercises with states like Jaime and some of the other folks that we participate in that, where domestic creation of PPE and some of those sources really was mentioned over and over again in the different sessions that we ran. That, you know, given the push to get the PPE in the hands and the need for immediate response, and the fact that the supply chain had cratered on that front, that a longer term vision was how do we emphasize domestic creation of some of this supply. So now that we're several quarters in, I'm curious, Jaime, is that still on your list? Are you working on that right now in terms of how you think about that? Or if Jaime doesn't have a specific thought on that, just overall, what is the importance of trying to drive more domestic creation of some of this supply in the long term from a strategic perspective?
Well, since you called on me, let me just start by saying I'm not here to sort of tout on Dustin, but I will be the first one to say the exercise that the state of Maine went through with Civic for the new normal was, to me, it was a game changer, because I'm in the middle of this coronavirus pandemic, trying to be up at 2:00 in the morning, calling manufacturers in China, working with brokers, trying to get a few hours of sleep either before and afterwards. And it felt like there was no end in sight. The entire supply chain had been disrupted. The entire procurement division and everything that we stand for, all our statutes, all our rules, everything's thrown out the window. Our processes don't work. There's no normal. And Dustin and I happened to be having a conversation one day, and he said, well, what are you doing to think about your strategic plan? How are you going to pull out of this? Like, the light's going to come eventually. And I cannot say it enough. I truly believe that is what gave me some hope to get through that pandemic when everything was just sort of falling apart. So in going through and thinking about the strategic plan and what are we going to do as the pandemic comes to a close, I'm really happy to say that we're sort of in that point where I can take a breath, I can go back to normal processes, and I can start thinking about, what do we need to change statutorily? Do we have to rely on the governor issuing an executive order and throwing all of the statutes in order to buy stuff or buy people to support the pandemic? And I would absolutely argue that there is a better way to think about these emergency situations. In talking to some of my colleagues from across the country on Monday, right? Florida's already looking ahead to hurricane season. There's folks that are thinking ahead to other natural disasters that are coming up. And that, the comment that struck me is that feels normal to them, right? They know, they have the playbook for how to deal with a hurricane or other natural disaster, the wildfires in California, the mudslides. And that really resonated with me because we need a playbook, right? And so now we're all starting to think about, what is the playbook? Let's write the playbook for the next pandemic. God forbid we ever get another one. But I do think that there are ways that we can be creative in our procurement processing and our statutes and our rules that don't involve emergency requests. Not everything is an emergency, even when we're operating in the middle of an emergency. And the very last thing that I would say on this, not to be incredibly long-winded, but I hope in the future when we have a pandemic such as this, or when we have like a worldwide disruption, the supply chain is able to adapt a little bit quicker. And I feel like we need a little bit more of a centralized worldwide approach to helping the supply chain come back to normal. Even in something like the Suez Canal, when the ship was stuck for what, 7 days or 10 days. I mean, that's 12% of the global trade that stopped for 7 days. That is a major impact on the world. And we should all be thinking, how do we pivot in the future faster, quicker, and more efficiently? I certainly don't have a crystal ball, and I don't have a perfect answer as to how the state of Maine is doing it. But what I can say is that I rely heavily on the plan that we did with Dustin, just thinking about strategically. We know that we have a long-term plan to create, and we have the guidance and the steps to be able to get there.
Jamie, thanks for your nice compliments. As I've heard in other rooms where you feel embarrassed about somebody saying something nice about you, I receive that. So, so talk to me about domestic PPE. Are we seeing any change? Is it fixed itself, or are we still having to go Pacific Rim for this stuff all the time? Victor, Christin, I don't know. Are you guys still frontlining PPE capture? Like, what does the market look like right now?
I will say our departments, because we kind of work in a hybrid and at the thresholds that they're probably soliciting, we're not having to really do a lot of searching and sourcing. And I will say my office is also not really getting a lot of feedback from departments needing to identify suppliers. So I feel like for us, I think there may be some balancing that's happening as far as availability, accessibility, nothing close to the uproar that we had initially at the beginning of the pandemic. I think gloves was maybe one of the last things that we kind of had to step in and really help source for them. But for us at our level, we're pretty okay. Yeah, we're pretty okay as far as finding what we need.
We're also slowing down in regards to requests coming in for PPE. We've had actually a surplus of it. We've had for quite some time, and we work with some community-based organizations, and we had several distributions, first to small businesses that they could sign up and come in and receive free PPE. And then we had a school drive too, where we had still surplus left over. And it was actually quite enjoyable. Our procurement staff showed up 6 o'clock in the morning and set up we worked in a drive-in theater where we roped and cars came in, and we handed out PPE along with a bunch of volunteers 4 or 6 times. It's a blur now, but that was kind of a side product that we were able to kind of step up and help the community.
So Dustin, just quickly on a couple of specific items, nitrile gloves, the product nitrile is virtually non-existent. So healthcare systems are looking at alternatives to nitrile. If you can get them, they're incredibly expensive, but for the most part, they are gone in the supply chain. The popular product, of course, is the N95 respirators. 3M has discontinued selling the 1860s and the 1860 pluses, which are the standard N95 respirators that you would see in a healthcare environment. 3M is only distributing to healthcare. They are not distributing to government or private entities associated with government, And they have created an alternative product called 1870s, which are similar, but they're not to the same. They certainly look different. And the healthcare professionals that we work with are saying, well, it looks different. We don't know if it works the same. We haven't seen testing, and they're very hesitant to use it. So we've been able to successfully utilize the 1870s in the education setting. I think those are probably the two hot commodity items. We are looking at another push when schools are hoping to open across the state full-time, 5 days a week in 3 weeks. And we have a surplus right now of PPE available for our education department and all the schools throughout the state. But I'm receiving requests that the clinical staff need a higher level and a higher volume of clinical items. So we're going through another run on that. And lastly, I think the biggest addition to the PPE is technology items, laptops, tablets, hotspots, phones, any of those devices. There are so many people across the country that do not have access to broadband, right? And the conversation that we had 30 and 40 years ago is that there were people that didn't have access to water and food. Now we're talking about people that don't have access to broadband, and that's a showstopper in their life for them. These kids can't connect with their friends, they can't connect with their teachers, and it's a pretty big deficiency, and the market has not caught up yet.
I have a quick question. Has anyone found a correlation between PPE demand from departments versus when they were receiving CARES Act? So our CARES Act funding ended, or let me say a large portion of it ended December 2020. And so I can see some tapering off kind of tied to that. Has anyone else experienced that in their space?
Oh yeah, definitely. When the money ran out, or when they thought it was running out, the request stopped. So the CARES Act money was extended through the 2021 year. And then there's, of course, more money funneling into education. And then we've got the APRA coming quickly. So there's more money coming. But now that the vaccine has started rolling out, and I think the big question is, how is the new round of money that's coming into states, and then people going back into the workplace, how does that balance out? And will that have a correlation on PPE requests?
That's a really good question. Yeah, that's a good question, Jamie. I didn't even think about that. Yeah.
Well, this sort of moves in the general direction where I was going to take us, which is, I think before all this, there was much more of an inclination to compress some of our contracts and to compress our warehouse spacing, and to have more of a just-in-time approach overall to supply, where the expectation was if you place an order, you'll get an order. And then through the whole period, then the move towards saying, well, now we have to really rethink our concept of stockpiling, and what do we need and how do we keep it? And then how do the feds need to rethink their approach to stockpiling? Because, of course, we had the whole issue about did FEMA have enough of what the stuff was, and there were anecdotes of there being federal acquisition of things that had been bought at a local level. So maybe come to Victor, and then Jenny, if you've got anything from your seat that you want to toss in, come in after Victor. But Victor, do you see a change in the mentality from where before maybe we weren't interested in conversations about stockpiling, where now there needs to be a more comprehensive thought to what does it mean to have things to where we can use them and we're not dependent on the market to immediately spin up and give us things?
It definitely is generating that conversation as to what things can we expect to happen that we aren't expecting. And I think that's where the discussion is focusing around is natural, man-made disasters, pestilence, things where we would have to have an emergency center stocked full of supplies, or a readily available list of suppliers that could meet our needs quickly and effectively. But I think that's more of the discussion is what can we prepare for that we're not expecting next?
And this is Jenny. I totally agree with what Victor has said and the other folks talking about these issues. I think one thing that I was on calls with CISA and MS-ISAC. They were focused on cybersecurity, but also we're talking about the supply chain. And one of the issues that came up was the transportation of PPE. And some states were not allowing transport trucks to cross borders. And that became a federal government issue where the federal government had to approve them transporting because each state had different rules. So just the transport of PPE became a major issue over a 3-week period until that was ironed out. And what was successful is that the federal government was working with the National Association of Governors, and they had a bunch of groups that were focused on trying to come up with a nationwide approach to distribution, even though I think there were some issues where the federal government kind of came in over the top for emergency reasons, and everybody was kind of fending for themselves on a state level. That did work its way out as there was better communication and collaboration. And I think that's a big push that I think needs to happen is just because we've stabilized a little bit and now we're focused on the vaccine, that we shouldn't stop these conversations, that supply chain is not just the availability, because there was availability in different areas, but you couldn't get to it, or it wasn't approved, it hadn't been approved to be used, or it couldn't be transported. So there's the end-to-end supply chain review that really needs to be discussed on a go-forward basis.
So while I let you guys decide if you have any questions you'd like to toss in with our group or join in the conversation with any of your own observations, Jamie, the NASPO conference is next week, and then we have Rob on a LinkedIn Live tomorrow on supply chain, so I'm looking forward to that. So Jenny was just talking about kind of some of the cross-state and federal coordination issues. So either among yourselves as states regionally, trying to stop the issues where there was competition among the supply chain that was artificially driving up the price, where the states were competing against each other. So either things that you've done across states that didn't necessarily involve the full NASPO view, or, you know, from a NASPO view, what kind of actions may they try to help nurture to drive a cross-state conversation about doing better on this in the future?
Dustin, so early on in the pandemic, the states were definitely not organized enough to try to come up with a cooperative solicitation or even jointly make large purchases together, which would have made a lot of sense. There were a few states in the Northeast we tried, and it was riddled with fraud, and it felt a little bit like the pandemic was moving too fast and the states just couldn't keep up. So it was, sink or swim. Your governor is telling you, you got to get this stuff, so get it here now. You can't wait for state X to help you out. But I have to give incredible kudos to NASPO, the National Association of State Procurement Officials. They pivoted unbelievably quickly, and they provided more resources than I could ever imagine for chief procurement officers who were tired and feeling just the fatigue of the pandemic. We had very quickly an entire place on the NASPO website of information. We knew what state was successful in buying what items from which vendors. We knew the cost. We were connected. I personally was connected with folks in Utah from Chris Hughes, and I was able to make a few purchases through them when I was slightly desperate. You know, I needed 10,000 surgical masks like yesterday, and I called New Hampshire and I said, hey, can you loan me 10,000 masks? So all of that was part of what NASPO did, is to help connect the dots. And I think at some point we did have a cooperative solicitation, but they've just done a great job. And then of course the COVID report that, Justin, I'm sure you're going to talk to Rob about. If folks haven't read it, I would really encourage you to go to the NASPO website and check out that COVID report. It's pretty incredible.
So let me go real quick to Victor, because he let me know he has a hard stop in a couple of minutes. Victor, if you're still there, you have insight into NIGP, which is somewhat more city-county focused, although it does come up to states. Did NIGP do much to try to coordinate across on these questions before you head out?
It's a good question, and I think I was more focused on my local avenue that I didn't really reach out to NIGP on this, except for their inter-member community end site where we could share information with all the NIGP members. I would say the Minnesota MCAP, now Infuse, was another cooperative that stepped up. We received a lot of good information from our regional contacts in regards to availability and assistance. So there are a lot of options. It's just a matter of how much time can you commit with the staff that you have in order to get things quickly, or do you want to do it more responsibly where you can get bids? In this situation, it was needed quickly, and whoever had it probably got the contract and the purchase order first.
Well, Victor, like I said, I know you let me know that you have a hard stop, so I'll plug the radio NIGP thing that you guys are doing. Since I didn't have the record button on before when I mentioned that, Victor's helping to lead an effort to put together sort of a polished half hour around the horn on public procurement issues and an audio and visual format. And you've got Richard Pennington telling jokes, so really, what more can you ask for, right?
And just to plug, the second show will be on April 21st, and we're talking about Reimagine, where we look back at the last year of the innovations that procurement were able to do to get creative, much with the PPE purchases, and how they can continue to move forward into a lot of areas that weren't allowed, i.e. e-procurement, electronic signatures, until it took a pandemic to get decision makers to go, oh, maybe you do need that after all. So it's just that's the focus of this next show on the 21st, and then resilience will be the topic for May. But if you go to YouTube and look up NIGP's channel, you can see the radio show there. But Dustin, thank you so much for the plug, and I thoroughly enjoy this group. I walk away with a lot of great ideas, innovation, and inspiration from all the members. Thank you.
Thanks, Victor. So Jenny, Victor mentioned a good issue on supply chain that we haven't talked about yet. So when we first started, FEMA released the guidance that put us into a period of emergency and exigency. I did pronounce that right, so I'm pretty pleased with myself. But that said that we could have relaxed rules on the way that we acquire, but relaxed rules doesn't mean no rules, and at some point those rules will change. So when we were first responding to the supply chain issues, we were able to go really fast and do contracts really quickly. And now some places people may have to be kind of rethinking how they come to market or how they keep that supply chain active without abandoning some of the aspects of public procurement contracting and some of our core principles. So are you dealing with that at all? I know as Chief Risk Counsel, and then also in the legal sense, I'm sure this is somewhere on your list of many, many things to do. So how do you start reteaching people to acquire when we're not able to continue to be in emergency and exigency forever?
Right. I think that, we're still considering an emergency, so that as long as PPE is limited, and it still is limited, we're not able to get 100% of the supplies for everybody, then it's still considered an emergency. We are trying to get more suppliers on contracts so that they can do statewide contracts, and it's less of a procurement issue. But when I think even with the CARES Act, we still have been giving out guidance to departments that they have to document what they're doing. And because we have best value, as long as they're going through a thoughtful process and they're not just going down the street because it's convenient, but they really are doing some sort of effort to obtain the best quality at the best price on behalf of the Commonwealth, then they're going to meet the procurement requirements, at least now. Once it's stabilized, then they return back to the normal process, which is very flexible to begin with. So I think it's making sure that people are documenting what they're doing. That's the most important thing that we've been hearing from the federal government as far as coming in and doing their inspector general's audits. So documenting what they're doing, the reason that they're doing it, and making sure it's compliant with the CARES Act. So I think those are the three things that we've been telling departments to pay attention to as they go through this process.
Jamie, I have this interview tomorrow with Rob, so I have a list of questions. What about supply chain should I have on my list that I should talk to him about? Like, when we have somebody who's actually truly a professor and a great mind on supply chain like Rob, and all the different ways we could take the conversation into vaccines and PPE and just general impact on where supply chain and public procurement cross, like, what are you interested in on this topic?
Well, so let me just read 2 sentences from the report that he helped produce. And then I think this is a great topic of conversation that he should weigh in on. This is a quote. So we found a vendor that could get us a lot of masks all at one time, and they had gotten a shipment in from somewhere, and then the actual boat was coming around the port. I have somebody drive down and hand them a check for the 25% deposit before the ship arrives at the port. The only way I can explain it is that it's like a Tony Soprano walked up to the dock, handed them cash, and took it. So that was a real story from a chief procurement officer in going through the COVID pandemic. And I think that is a true story of how CPOs across the country pivoted in trying to buy PPE and take care of their state. So Dustin, I think Rob could absolutely shed some light on, I hate to use the word innovative, but it's the only thing that comes to mind, the unusual ways CPOs were able to provide PPE throughout the pandemic. And I would love to hear his take on not only what happened, but also in learning what happened, where do we go from here, right? He's the expert. Give us some insight as to, where CPOs can go from here to be more effective in the future.
Hi, it's Dustin Lanier. Thanks for listening. Please find me on LinkedIn for original public sector operations content every week. And please reach out to me if I and my team of procurement professionals at Civic Initiatives can help you be a public procurement change agent.